Hello and welcome to this new video where we are going to discuss another 10 MCQs from a new topic that is called as the Papulosquamous Diseases. So in the Papulosquamous disease, today we'll be discussing some MCQs from psoriasis, some from lichen planus, some from pityriasis rubra pilaris and other topics. Okay, so let us quickly see what are the MCQs that we'll discuss today. So let's get started. The first question is, Voronoff's ring is a feature of. So in which disease do you find Voronoff's ring? Option are psoriasis, lichen planus, pityriasis rosea and pemphigus. So this is pretty much a direct question. The answer here is psoriasis, where you find Voronoff ring. Now what do you mean by a Voronoff ring? So you can see this image here. So in this image you can see that there is a central area of erythema followed by a rim of pallor. So in some patients of psoriasis, you will be able to see such a kind of a lesion where the central part would be red in color followed by a rim of pallor, and this is called as a Voronoff ring, and this is typical for psoriasis. So let us see the next question, that is, effective topical agents for the treatment of dandruff include all except. So topical agents means those we apply over the skin. And what are the effective topical agents for the treatment of dandruff except? So the options are azelaic acid, cyclopirox, ketoconazole, and the last one is selenium sulfide. So what do you mean by dandruff? Dandruff in medical terminology we call it as seborrheic dermatitis. So we are talking about seborrheic dermatitis now, and we all know that seborrheic dermatitis, there is a hypersensitivity reaction of our body to a commensal yeast, as in Pityrosporum ovale, isn't it? So what happens, since there is a commensal yeast that is involved, we would be using all these antifungal agents like cyclopirox, ketoconazole or selenium sulfide in the treatment. So all these are antifungal agents used. So the odd one out in this all these four options is going to be azelaic acid. Azelaic acid is again a skin lightening agent which is not used in seborrheic dermatitis. Instead it can be used in other diseases. Okay. So let us see the next MCQ. Monroe's micro abscess is seen in. This is again a pretty much direct question. It will be a quick revision for you. Monroe's micro abscess. So Monroe's micro abscess is an example of a neutrophilic micro abscess. So where do you find Monroe's micro abscess? This is typical in the case of psoriasis. This is seen in psoriasis. This is not seen in lichen planus or mycosis fungoides. This is seen in psoriasis. So what is the other name of the neutrophilic microabscess that you see in psoriasis? The other name of neutrophilic microabscess that you see in psoriasis is the pustule of Kogoch. Okay, pustule of Kogoch. So these are the two neutrophilic microabscess that you see in psoriasis in the histopathology. So let's see the next MCQ, that is, lesions of pityriasis rosea are mostly distributed on the. So where do you find the lesions of pityriasis rosea? So before you look at the options, let us first understand what is pityriasis rosea. So pityriasis rosea, as you can see in this image, the patient may present to you with a single lesion initially. This lesion is called as the herald patch, or this is called as the mother patch. So once the patient would come to you with such a lesion, what happens after a few days time? Within a few days time, what happens? Multiple erosions, multiple eruptions of smaller erosions would start appearing over the skin. So these kind of multiple eruptions are going to take a shape of a Christmas tree. Hence this is called as a Christmas tree appearance of the rash. Christmas tree appearance of the rash. So as you can see in this image, where are the lesions present? The lesions is present over the trunk. So in the options pityriasis rosea, they mentioned the face, the trunk, the scalp and the palms and soles. So the right answer here would be the trunk. So let us see the next question, that is palmoplantar keratoderma is a feature of. Options are pemphigus, verruca plana, psoriasis and pityriasis rubra pilaris. So what do you mean by palmoplantar keratoderma? So let us see the next image, that is this is called as palmoplantar keratoderma. So what do you mean? There is going to be a thickening of the palms and the soles, and there is going to be increased scaling as well. So in this image you can see multiple findings, that is you can see some keratotic papules are seen over the skin. So this keratotic papules is actually compared to a nutmeg grater sign. Nutmeg grater sign. And you can see a red to orange kind of a skin lesion with islands of sparing. Islands of sparing. So what do I mean by islands of sparing? Out of the entire area of the skin has turned out to be red or orange in color, whereas there is some area where you can see the normal skin. Can you see the normal skin in some area? So this is mentioned as red to orange kind of lesions with islands of sparing, along with keratotic papules that you see over the skin, which on palpation will give you a nutmeg grater kind of a feel, hence called as a nutmeg grater sign. Along with palmoplantar keratoderma means there is going to be increased thickening and scaling of the skin of the palms and soles. So all these features together is going to be seen in a disease that is called as pityriasis rubra pilaris. So the answer would be pityriasis rubra pilaris. So let's see the next one. Cobnus phenomenon is seen in. So options are leprosy, pemphigus, lichen nitidus and scabies. So what do you mean by Cobnus phenomenon? Cobnus phenomenon means there is development of skin lesions at the site of trauma. At the site of trauma. So if the patient would develop a skin lesion at a site of trauma, this is called as Cobnus phenomenon, or it is also called as isomorphic phenomenon. This is also called as isomorphic phenomenon. So you basically see isomorphic phenomenon in three diseases, that is lichen planus, vitiligo and psoriasis. So you can remember it with the mnemonic LVP. Lichen planus, vitiligo and psoriasis. So look at the options here. So leprosy, pemphigus, lichen nitidus and scabies. So the best option here would be lichen nitidus. So the best option is lichen nitidus. So let us see what are the various types of Cobner phenomenon. Okay, the true Cobner phenomenon which we discussed just now is this one, that is a skin lesion would develop at the site of trauma, that is seen in LVP. Now there is sometimes a phenomenon that is called as a Pseudocorbis phenomenon. This is usually seen in viral infections, where there is going to be an auto-inoculation of the virus. So this is seen in warts as well as in molluscum contagiosum. And there is a phenomenon called as a reverse Cobner's phenomenon. Now what do you mean by reverse Cobner? Just opposite to the main Cobner. Means at the site of trauma, the lesions would be disappearing rather than appearing. So if the lesions disappear at the site of trauma, this is called as reverse Cobner, and this is seen in vitiligo, psoriasis as well as in granuloma annular. Vitiligo, psoriasis and granuloma annular. Whereas there is a different phenomenon called as remote reverse Cobner, which means there is going to be a trauma at one site, but due to the trauma at one site, the lesion would be disappearing elsewhere. Means that can happen in cases of vitiligo again, along with granuloma annular. For example, if you do a skin biopsy at one site of the vitiligo lesion, and the symmetrical lesion of vitiligo that you see in the opposite hand, may disappear due to the surgery, due to the skin biopsy that we have done in the opposite hand. This is called as remote reverse Koebner, and that is seen in vitiligo as well as in granuloma annulare. So let's see the next MCQ, that is, a non-case of diabetes develops annular orange lesions which disappear after biopsy. This phenomenon is called as. Now before I ask you what is the name of this phenomenon which we have discussed just now, what is this condition called as? So a patient of diabetes is developing an annular lesion, means a rounded lesion which is orange in color, and this lesion is disappearing after biopsy. Okay, so this is called as granuloma annular. So the diagnosis here is granuloma annular, and what is the condition? Is it Koebner's, is it reverse Koebner's, is it Aspo-Hansen sign, or is it isotopic phenomenon? So here the answer is going to be reverse Koebner. Why? Because the lesion is not appearing here, instead the lesions are disappearing after the trauma or after biopsy. So let's see the next question, that is, all are true about psoriasis except. First one is it is a very pruritic condition. Second one, there is going to be pitting of nails. Third one, joint involvement in 5 to 10%, and option D, parakeratosis and acanthosis. So let us see what happens in psoriasis. In psoriasis, you would be able to see these kind of lesions which is called as erythematous plaques with silvery white scales. So you will be able to see erythematous plaques with silvery white scales, especially over the extensor surfaces. So along with the skin lesions, the patient may come to you with something like this, where there is multiple depressions over the nails, which is also called as pitting of the nails. So pitting of the nails is seen when psoriasis can involve the joints, when it is called as psoriatic arthritis. So psoriatic arthritis, pitting of the nails and the skin lesions, everything is seen with psoriasis. But psoriasis, please remember, this is not going to be a itchy condition. So here the answer would be, this is not going to be a pruritic condition, hence, so this is the odd one out. So let us see the next MCQ, that is, a 30-year-old male presented with silvery scales on the elbow and knee that bleeds on removal. So probable diagnosis is, again, since we are repeating the same thing, erythematous plaque with silvery white scales, anywhere the diagnosis is going to be again psoriasis. But what is this phenomenon? Like if there is some scaling, and if you are trying to remove these scales, and you are going to see some bleeding spots like this. So these bleeding spots on removal of scaling, this is called as a typical sign, that is called as the Auspitz sign. This is the Auspitz sign that you see in psoriasis. Now let us see the last MCQ for the day, that is, a 35-year-old male presents to a clinic with deep-seated pustular lesions over the palms and the soles. So these pustules are sterile on examination. What is the most probable diagnosis? So this is a patient who is presenting with multiple pustular lesions. So anytime you see multiple pustular lesions, you are always suspecting something like a bacterial infection. But the question says these pustules are sterile on examination, means there is no evidence of bacteria, there is no evidence of any contamination. So what are the options? The options are lichen planus, HSV infection, palmoplantar psoriasis, and contact dermatitis. So I'm sure by this time you know the answer. So any sterile pustule, especially with the classical variant, where you see deep-seated pustular lesions over the palms and soles, is going to be palmoplantar psoriasis. Palmoplantar psoriasis, and the key point to remember is, in palmoplantar pustular psoriasis, you will be able to see multiple pustules that is going to be sterile on examination. That is going to be sterile on examination. Whereas there is a condition in HSV infection, that is herpes simplex infection. This condition is called as herpetic Whitlow. So in herpetic Whitlow, what do you see? You are not going to see a pustule, rather you will be able to see some vesicles. You will be able to see some vesicles which is going to be painful. And these are painful vesicles, especially seen over the tips of the fingers and all. This is called as herpetic Whitlow. That is going to be a viral infection. Whereas here, since the pustules are sterile, this is called as palmoplantar pustular psoriasis, which is the classical variant. So that is all about this quick revision of 10 MCQs from this chapter called as Papulosquamous disorders. I hope you enjoyed the session. Thank you so much.